topic is going to be Medicare Advantage. Is it a trap? I think it is for some people not so much, and we're going to talk about that today. My name is Ed Weir, former manager of the Social Security Administration. I've helped millions of people throughout my decades working inside the bureaucratic beast and afterwards with all things Social Security, retirement, disability, Medicare, Medicaid. This is a live broadcast right now. If you're watching this live, if you have any questions, how this is going to work is I am going to, let me put up my little thing here. I'm going to talk about today's topic for about 10 or 15 minutes. And then we'll get into the live Q&A. And if you're watching this later, you're looking at this, I don't want to, watch a video about an hour about Medicare Advantage. The Medicare Advantage part is about 10 or 15 minutes, and then I spend the other 45 minutes or so answering everybody's questions on all things Social Security, Medicare, disability, survivor benefit, spouse, and all the rest of it. So type your questions in chat, and if you're watching it later, make sure you subscribe. And that way, if you or your family have any questions at all that, you can find us. There's so much stuff out there, it's hard to find sometimes. All right, let's get right into it. Medicare Advantage. It's a trap. I'm sure a lot of people recognize the old scene from Star Wars there. So I'm going to talk about how it's a trap, why it's a trap, how you can escape it or avoid it, and what do I recommend. People ask me all the time, Ed, what would you do if you were in my situation? So I'm going to recount in each particular situation what I would do. Depending on, whether you're a vet, whether you're receiving, Medicare and Medicaid, whatever the case may be. All right. So first of all, I guess we need to answer the question of what is a Medicare Advantage plan? So when people sign up at 65 years old, or they get Medicare from being on disability for 2 years, so 65 or being on disability for 2 years, you get Medicare, sign up for Part A and Part B. Remember, you don't have to sign up for Medicare at 65 if you currently have insurance from work, yours or your spouse's, and your employer has 20 or more employees. Save yourself $174.70. But if you go ahead and sign up for Part A, Part B, perfect, awesome, avoid the penalties. I'm going to do a video, I think it's tomorrow, on avoiding the penalties of all that. So that's great, but you have original Medicare now, and there's a lot of gaps. There's like 6 major gaps. The big one is the Part B coinsurance. Medicare Part B, which covers your doctors. Part A covers the hospitals. So Part B covers 80%. So if you have a $100,000 surgery, then you have to cough up $20,000 cash to pay for the rest of it. So unless you've got a whole bunch of money sitting around in the bank, you need something else. So people either get a Medicare supplement plan or a Medicare Advantage plan. And if anybody that watches my videos, I always recommend a Medicare supplement plan, either a Plan N or a Plan G, because you don't have the pre-authorizations and the networks and all the rest of it. You don't have to deal with the insurance companies. If your doctor says you need it and Medicare covers it, you're done. But a lot of people, unfortunately, can't afford the monthly premium for a Medicare supplement plan. Over 50% of Americans today get a Medicare Advantage plan. And we'll talk about, did you fall for the trap? And if so, what can you do to get out of it? Medicare Advantage, so that's Medicare supplements. Medicare Advantage, those are the ones you see there's a whole bunch of them out there with zero premiums. And their extra benefits, dental, vision, hearing, gym membership, some of them, those flex cards you hear about over the counter and electricity and all that kind of stuff. So they are out there. Those are not internet myths. The way they advertise those are kind of bait and switchy. Medicare, the government has finally come down on those companies. Basically, what they've been doing is they find the best plan in the entire country, and it gives you, free ice cream and unicorns. And then they advertise it to the whole country. And then everybody outside of that one little city that has that free ice cream and unicorns calls up and say, hey, I want free ice cream. And say, oh, sorry, yeah, you live in anywhere else other than this one place, and so you can't get it. And then they give you the whole hard sell and stuff. So kind of a bait and switch, and the government has finally come down and said, no, you can't do that. So they get a lot of, extra benefits, the zero premium. But it comes at a cost, and those are the authorizations. You have to get pre-authorizations for a lot of things. Sometimes the insurance company will deny what the doctor says you need. Sometimes they will stall. You have to have certain networks. You can't go to this doctor, and those networks change on a regular basis. And all of those plans are only good for 1 year. When you get a Medicare supplement plan, also called a Medigap plan, pretty much people stay in like a G or an N forever. The only time people really change this is they move, or if they're in the G that's starting to price go up, they look for a cheaper G, or N's are usually about 20% cheaper across the board. So if their G is starting to get expensive, they switch to an N. And if you need help with that, I put together a team that can help you with that. So the Medicare Advantage, those are only good for 1 year. So everybody's plan, if you have Medicare Advantage, your plan expires like Cinderella, December 31st at midnight, and you get a new plan. You might have the same card, same name, same company, same doctor, same zero premium and all that. But, insurance companies aren't dumb. They don't get to be billion-dollar insurance companies by, changing stuff that you will notice. They change the underlying things. So next year, when you go to the hospital and they charge you $500 a day, you're like, wait, when I signed up for this 2 years ago, it had $100 a day. Yeah, that one expired a couple of years ago. So one of the things we see happening is people get into a Medicare Advantage plan and they say, well, I'll just switch to a Medicare supplement later. That's difficult. Not impossible. If you are in a Medicare supplement plan and you just can't afford the premium anymore, some people are unfortunately switching to a Medicare Advantage plan because they just can't afford the supplement. And you can switch to a Medicare Advantage plan yearly. Most of the time, it's during the annual enrollment period from October 15th to December 7th. So some people change from a Medicare supplement to a Medicare Advantage. No problem, easy. Going from a Medicare Advantage to a Medicare supplement, that's difficult. Depending on if you are 70, 75 years old and you are really healthy, you could probably do it. If you're not, then it's going to be very, very difficult unless there's very, very limited exceptions. If you move, if your Medicare Advantage company is leaving your particular area, you might have a special enrollment period. And by the way, a lot of the companies out there, the health insurance, Medicare Advantage health insurance companies have already you probably saw in your local newspaper that this company is leaving this area, this company is leaving that area, this company is downgrading their benefits in this area, this company is getting rid of these particular plans. So we see a lot of that. 2025, this year, there's going to be a lot of change for the 2025 season. So to switch from a Medicare Advantage to a Medicare supplement, you'll need the health underwriting unless you come up with some special enrollment period. So here's kind of where the trap comes in. You've got a lot of these Medicare Advantage companies. Again, they're doing very, very well, making tons of money, and they have over 50% of the people signing up for them because there's lots of savings. And over the last few years, the Medicare Advantage plans have been very good. A lot of extra benefits, a lot of savings. Not very much for MRIs or CTs or hospital stay, and extra dental and vision. So these companies have been working hard to get people in. And it's my personal opinion, and a lot of other people out there, that's again, these billion-dollar insurance companies are smart. They get you in, and then when you're young, 65, 66, 67, and you're healthy and you don't really need a whole heck of a lot of health care, so you don't really care, you get into the Medicare Advantage plans, and then you're kind of trapped in some respects, because if something happens, you fall or you get sick, and then pre-authorizations and out of pockets for this and this and this other thing. With a Medicare supplement plan, if you have like Plan G and you have to go to cancer treatment and it costs $1 million, guess how much out of pocket for Plan G? $240. You're done. There's a one-time Part B deductible of $240 this year. And the other $999,000, whatever, is paid for by Medicare and the insurance company, and they can't say anything. But a Medicare Advantage, you have to go to the pre-authorizations and out of pocket here and there. There's a max out of pocket, yes. But so there's enticing to get all the extra benefits and the gym membership and all the rest of it. And then they get you in there. And then later I get calls every single day. People leave comments every single day. I want to get out of the Medicare Advantage plan. Sorry, you can't. You're stuck. You had a heart issue. You had this. You can't switch to a Medicare supplement. You're essentially stuck with your Medicare Advantage plan. And so this kind of gravy train, all these extra benefits that have been coming down over the last few years, getting people into a Medicare Advantage plan, and now, unfortunately, it's going to be tough to get out of there. And this is one of the key years, because this year, 2024, there's more people turned 65 this year than any time in US history. So that's another reason these health insurance companies have really, really gone out of the way to get people into the plan. And we don't know how long, these zero premiums, you're like, well, zero premium, but it's zero premium. Yeah. But again, these plans are good for 1 year. You didn't sign up for zero premium for the rest of your life. It's zero premium now. But once, we don't know. We don't know. Maybe in 5 years or 10 years, zero premium will be a thing of the past. And now there'll be, $100 premium or whatever the case may be. And then you'll also have the pre-authorizations and all the rest of it. So nobody knows the future. That's why I say, if you're able to, Medicare supplement all the way. However, there are times when I would 100% get a Medicare Advantage plan. People say, I always, talk about Medicare Advantage. Not necessarily. I mean, if you can afford it, Medicare supplement all day long. However, there are certain situations people ask me, what would you do? Well, here we go. What would I do? What would I recommend? If I was receiving Medicare and Medicaid, it's called dual eligible, 100% I would get a Medicare Advantage dual eligible plan. Medicare Advantage, there are extra benefits in there, a lot of cost savings, and because you can't get a Medicare supplement anyway when you have Medicare and Medicaid. Okay, so I would get a dual eligible plan in that case. However, there is one caveat. A lot of Medicare insurance people won't tell you about. If you have home health care, people coming out to your house on a regular basis, and you have Medicaid, I would be careful. If you get a Medicare Advantage plan, a lot of those home health companies don't like Medicare Advantage plans. They would rather bill Medicaid directly because they get paid faster and get paid more. So if you're gonna say, hey, but I really like this extra $100 a month for electricity or something like that on a Medicare Advantage dual eligible plan. Okay, perfect. Yeah, $100 extra a month is awesome. But check with your home health company, the people that come out to your home and do whatever you need to do, take care of you, daily living necessities and stuff, and ask them, hey, I got this $100 card. Do you think I should? And they'll say, oh, if you take that, then we can't come out anymore. So, but if they say, oh yeah, we take that, just be careful. Yeah, nobody will tell you that, but be careful. If I had a VA, I'm an old Marine Corps sergeant, so if I had VA medical, I wouldn't get a Medicare supplement. Absolutely not. I'd get a Medicare Advantage plan, and because most of these VA people use VA medical facilities, they go to the VA and they're happy, and so why spend extra money? So, but you can get Part B and get these Medicare Advantage Part B givebacks, where the Medicare Advantage company pays part or all of your Part B premium. So you can have your kind of cake and eat it too. Have your VA medical plus kind of a fallback position that's not costing you any money. Maybe some extra dental and vision, whatever. TRICARE, definitely I wouldn't get a Medicare supplement. I would do a Medicare Advantage. If you had a crystal ball and 100% for sure you're going to live the next 50 years and you're not going to get sick and you're not going to get injured or anything like that, if you got that crystal ball dialed in, I would 100% get a Medicare Advantage zero premium for the next 50 years, because why waste money on a Medicare supplement premium that you're never going to use because you're never going to get sick? But yeah, yeah. If I just couldn't afford the premium for the Medicare supplement, which unfortunately is one of the biggest reasons people don't get a Medicare supplement, I say, hey, you watch my videos, I recommend NNG. And they say, yeah, I know. I just can't afford it. Then a Medicare Advantage is the way to go. But there's a trick there. There is a trick. You need to not let it ride. Do not let it ride. Do not sign up for a Medicare Advantage plan and just let it ride for the next 5 or 10 years. That's what the insurance companies want you to do, because your insurance company in your area, XYZ Medicare Advantage company, they have 1, 2, 3, 4, 5, 6, 7, 8 different plans, and they're coming up with new plans every year, phasing out old ones. And you might be at you might have one of the phased out ones that they're just not selling anymore, and they deteriorate your benefits, and you don't know it until you know it, until you get sick or go to the doctor or fall or something like that, and then you're like, oh my gosh, I didn't know I had to pay that much. Yeah, that was kind of the intent, is to kind of keep you in the system. So what I would do is once a year, I would spend an hour, get with your agent or broker. I recommend brokers. An agent, a traditional agent, is it's called a captive agent. They work for one company, XYZ Medicare Advantage company. And if you call them up and say, hey, what's the best? Guess which one they're going to suggest, right? You little Henry Ford, you can have any color you want as long as it's black, right? So a broker, a broker is contracted with several different companies in your particular area. So they work for you. You call them up and say, hey, in October, the new plans for 2025 are going to come out. Let's talk. Let's spend an hour, go through my plan and make sure I'm still in the best plan. If I'm still in the best plan, you don't have to do anything. You just let it ride. If you're not, if your benefits and costs have increased, deteriorated, increased, the costs have increased, then it's, you need to find another plan. So don't let it ride. Because remember, this is your money. These Medicare Advantage companies are not giving you this money. They're just because they're awesome and, they love you so much. This is your money. All that money you paid into FICA, all those decades, it's in Washington or Fort Knox or wherever, chock full of canned nuts out in the back of the White House. And when you sign up for XYZ Medicare Advantage company, that company goes to Washington and says, hey, John, Jane just signed up with our company. Give us that person's money that they paid into FICA all those years. And the government gives over your FICA, all your FICA taxes that you paid. And that's the money that they're giving you that you think, oh, this company's really nice. They gave me free dental and they gave me glasses and they gave me gym membership. No, that's your money. That's all your money. They're just giving it back. So get your money back. That is your money. So again, because I've seen so many bad actors out there that don't, kind of the captive agents, the people don't tell you the details, like about the home health care and stuff like that. That I decided to go ahead and just put my own team together. So if you need help, just click on the link there, and it'll have a spot where it says one-on-one Medicare help, and you click on the Medicare help button. And then in there, it'll say, hey, I'm good now, but put me on your list for October. And then we'll put you on our list for October, and we'll call you up when the new plans come out, and we'll compare what you have with what's available for 2025 with the same company or a different company. Make sure you keep the doctors you like and you save money on your prescriptions and all that. That's 100% free service. No agent or broker charges you for that. All right, so I did that. Ooh, it take a little bit longer. Usually these topics of the day are about 10 or 15 minutes. I spent a little bit extra time on that. So let's go ahead and move into the questions. And the questions don't have to be about Medicare itself. It could be about anything: spouse benefits, retirement, disability, all the rest of it. All right, first question. Barbara. What's up, Barbara? If you're collecting widow's benefits now and apply for your own benefits at 70 and 6 months, are you entitled to back pay? Usually they give you, after your full retirement age, they can give you 6 months of back pay, retroactive benefits. So yes, absolutely. If you're slow, you should have got them at 70. Sounds like you realize that, because your benefits on your own record don't increase after the month you turn 70. Unlike when you turn 62, you have to be 62 the entire month to start your benefits. 70, it's that month. So the month you turn 70 is when you should have started your benefits. But you should be able to rectify that mistake. Just ask for the 6 months retro. But Barbara did awesome. Way to go, because you did a strategy that a lot of people don't know about. Is you can collect survivor benefits and you don't touch your own benefits. You let your own benefits increase and you continue to get survivor benefits. Some people even get survivor benefits even though they're less to begin with, because your benefits continue to increase until your full retirement age and increase more, 8% every year until you're 70 years old. So Barbara, good job on that. Good job. Let's see. Sweet Pea, hello there. Love your channel. Oh, appreciate it. Appreciate it. I'm on SSDI and work part-time. What is the bid max I can earn? I did a video on that about a week or so ago. It gives it all the details. This year, there is a trial work period. Well, it's every year, but this year, the trial work period is, it triggers at $1,110. So if you go over that, you've triggered a trial work period. If you stay under that, Social Security doesn't care. And then once you finish your 9-month trial work period, which is not necessarily consecutive, then you get into what's called the extended period of eligibility for 36 months. And then every month you go over the substantial gainful activity, which this year is $1,550, then you're not entitled to that month of check. So watch my video I did, I think it was about a week or 2 weeks ago, on Social Security disability and working. Oh, I had a question yesterday that I want to elaborate on. Someone said, because when you call up Social Security and you want to file for divorced spouse benefits, I say you don't need the Social Security number. They can find the Social Security number. But they won't give you, well, most of the time, 95% of the time, they won't tell you the Social Security number of your ex-spouse or deceased spouse. Well, more easily ex-spouse or deceased divorced spouse, because they don't know who you are. Maybe just someone just trying to find someone's Social Security number, and so they won't give that to you. They will look it up and they will see if you get any benefits. But once you go down there, if there are any more money there, once you go down there and prove your relationship or provide your marriage certificate, divorce decree, and all that kind of stuff, then when you get the decision letter, the award letter, it'll have that number on there. Basically, it'll say NH and CL. NH is, I've done hundreds of thousands of these claims when I worked at Social Security. NH is number holder, and the claimant, CL, is the claimant. So the number holder is your the higher record spouse, ex-spouse, divorced spouse, deceased spouse, and then you are the claimant getting benefits off of the number holder's record. And then the decision letter, everything will have the Social Security numbers on there. So you will get the Social Security number eventually, but they just don't give it to you out of just anybody calling up. Medicare Advantage is a private control of what Medicare was never intended to be. The old could not afford insurance and were being denied care pre-1965. That is a fact. Yeah, Medicare started in 1965 under LBJ, and about 20 years, that's when they started the whole Medicare Advantage thing. And it's interesting, the government thought they were going to save money, by kind of controlling costs. They figured companies would control costs, and they do for the companies, but then they don't pass those savings on to the government. And it's all the analyses have shown that Medicare Advantage plans actually cost the government more than if people just stayed on regular Medicare. So something has to be done. And that's why stuff is being done. Medicare start paying these companies less, and they're requiring them to do more things. I've talked about this in other videos. And that's why 2025 is going to be a very, very big upset year. We're going to see the biggest changes in 2025 than we've seen in many, many years, for the negative, unfortunately. Again, a lot of companies are pulling out of areas they're not making enough money in. They're reducing benefits. They're closing up plans. So yeah, it's very, very important that you do the right thing and reach out to someone that you know and trust and review your plan. And again, let me put my my link on there in case you need help. Because one of the other things, you're like, oh yeah, I've got someone that helped me out that I talked to last year on the phone. They might not be there anymore, because one thing that Medicare did do, which is an awesome thing, is that they are Medicare insurance agents and brokers are highly, highly regulated, which is a good thing. We don't want these people ripping off, elderly people and people are disability. But all the 20 or 30 Medicare calls everybody's been getting, Medicare, the government is trying to stop those. So some of these big call centers, that was their MO, that was their business plan, to just harass people all the time. And now they can't do it anymore. So a lot of call centers shut down. So if you have, oh yeah, I'll talk to that same person, you call them up and all of a sudden it says, yeah, this number has been disconnected. You know why. Yeah. All right. Let's see here. All right. Let me get into. Sorry, I jumped a little bit here. Let me get back to where I was. TIZ, I would not say I fell for the advantage trap. It comes down to what I can afford. Exactly. Yes. So it's kind of yeah, you didn't fall for it. You did a conscious decision. I should have mentioned as I was. I don't know if anybody's watched the old that series, The Band of Brothers, but you know Marine Corps recon, the reconnaissance, and paratroopers and Green Berets and stuff. They have the same type of philosophy. It's when they parachute in behind enemy lines, and people, you're surrounded. It's like, yeah, that's that's our job, is to be surrounded. We're paratroopers, recon. So people that have essentially gone behind enemy lines in Medicare Advantage, as long as you do it, that you understand the situation you're in and you check. And one of the things about checking is not only checking kind of the general health benefits and the costs that you're exposed to, but it's also using it for your own benefit. Like I was talking about yesterday about this. Um, if next year you have a bunch of dental type stuff that you need done, find a plan for next year that really covers the dental. And you're like, wow, this is really good for dental, but it's, extra for hospital, but hopefully I won't go to the hospital next year, or, a bunch for a CIC specialist and all these extra costs and stuff like that. But the dental is really awesome. So for next year, let me go ahead and get this plan with a whole bunch of dental, get my dental work done. And then next October, I'll switch back to, the other plan. So again, this is your money, shop smart. And again, spend an hour with someone that you know and trust, and they can walk you through it. Let's see. Oh yes, yes, and I'm sorry, I didn't read the rest of it. I'm considered trying out the Medicare Advantage plan for a year. Good, yes, thank you. That is another reason I should have added in there why you have a kind of a trial period. So if you sign up for Medicare Advantage and you don't like it within a year, you can switch to a Medicare supplement. So some people do that. So that's a very good, that's a smart way to do it too. But you have to make sure you get that change done before the year is up, or you'll have to go through health underwriting. And the health underwriting is, it's not, where they're going to, send you to a doctor for a physical and stuff like that. Most of the time, it's just the broker. You call them up and say, yeah, I want to switch to, from a G to an N, or an N to a G, or from Medicare Advantage to a G or an N, or whatever the case may be. And you're outside of, you're not 65 anymore, whatever. So you have to go through health underwriting. And so they just ask you about 30, 35 questions. And if you answer no to them, you're done. Easy. So sometimes they'll, request medical records if you answer yes to some of the things. And sometimes you can answer, some of the questions. Usually those questionnaires are like in two parts, where if you answer yes to any of the ones on the top, you're automatically denied. If you answer yes to anything on the bottom part of the questions, then it's like, okay, that's, it's case by case basis. So try it. Doesn't hurt to try, right? If Project 2025 is passed, did you say you will have to get Medicare Advantage without option to get supplement? The Project 2025 and the Republican Study Committee report, both of them, yeah, basically they want to make Medicare Advantage the default option. Not that you can't necessarily switch to a supplement, but they will automatically stick you into a Medicare Advantage plan, as soon as you sign up for Part B. And that's a slippery slope in terms of people are just, okay, I get it, and then you forget about it, you're signed up, and people go on with their life, they're busy and stuff like that, and they got A and the B, and all of a sudden they get a Medicare Advantage plan, and oh, okay, I guess that's what you get. And then, yeah, then you're trapped after a year possibly. So, Sweet Pea, what is a supplement Medicare? I'm 70 and started getting Social Security at 62, but never used my Medicare. What do I have then? I do not pay extra for anything, just the average. Yeah, so you probably have a Medicare Advantage plan. Yeah, so if you don't know what you have, um, click on that little link I put there. And again, pick the little option that says one-on-one Medicare help, and a little form will pop up and it'll say, I'm good now. Put me on your list for October. And then October, we'll schedule a time, and one of my brokers will reach out to you and compare what you have with what's available for next year. So you've probably let it, you let it ride for years, your Medicare Advantage. So yours is probably a plan that the company doesn't sell anymore, and they're just slowly deteriorating the benefits, and that's how they make money. They're smart. The insurance industry should be banned from healthcare. It was a result of World War II workers' benefits from Kaiser. Wow, wow, yeah, yeah, the HMO and stuff like that. Kaiser and Blue Cross Blue Shield. Yeah, they were. They were definitely the ones that start there. A little historian. I like it. I like it. Yeah, as regular viewers know that if I was dictator for a day, you would have Medicare Part E, or I would just close all the gaps of Medicare Part A and Part B, and all those 80% and deductibles and stuff like that. And maybe Part E would be vision, dental, and hearing. That would just be added on there, and we wouldn't need any private insurance like that. But yeah. How can I pay those bills once I die? Yeah, obviously that lump sum death payment that is left to your survivors, $255 doesn't do it. So that's another reason I've also put together the people that can help you with the Medicare plans. Some people in the office can also help you with burial insurance. So if you have money, sitting around in case that to pay for burial and leftover medical bills and all that kind of stuff, then you're good. But if you don't, it's good to get some type of burial insurance. All right. Sunshine, what's up, Sunshine? My husband's ex-wife earned much more than he did. Both received retirement benefits past 12 years. It's been over 8 years since we were married. Can he get the higher benefit? All right. So your husband's ex-wife earned more, but only because he's currently married. So he can't get benefits on that person's record unless that person is deceased and he remarried you after the age of 60 years old. So again, his ex-wife has to be deceased, and you two had to have been married after 60 years old. If that's the case, he can get surviving spouse benefits. JC, I know a person that draws SSI and SS. Their next birthday, they have some hospice due to illness. His next birthday, they will be 64. What should this person do trying to help? Oh, awesome. Good deal. Well, not good deal for them, but it's good that they have someone like you to help out. Yeah, hospice. A lot of the the Medicare supplemental, the Medicare Advantage and stuff doesn't cover hospice. Original Medicare does. But there's also hospice would be original Medicare. Long-term nursing isn't covered by pretty much anything except for Medicaid once you've exhausted all your funds. But yeah, original Medicare. So reach out to the hospice facility, and they will walk you through the entire process and find out what that person has. Right now, in the middle of the year, they probably, well, if they're receiving SSI, they might be able to switch their Medicare Advantage. Yeah, well, if they have SSI, they probably have Medicaid as well. So they probably have Medicare and Medicaid. If they have SSI, they're categorically eligible for Medicaid. So I would call the hospice facility that y'all have chosen, and they will run it. They will find out exactly what this person has, whether they have Medicare and Medicaid and a Medicare Advantage and a Medicare supplement, and they'll tell you exactly what's going to happen. So yeah, sorry to hear that, but it's good to have people out there looking out for you. Can you review the risks of taking an Advantage plan for the 1-year trial period? Thanks for your education. Yeah, there is no risk. The only risk is you forget to switch. But again, if you're still healthy after a year, then you can just do the health underwriting, and it's not a big deal to switch. Um, but you know, life being life, people get busy and they miss the 12-month period, and then something happens, or they have something that happened, at 64, they had, hospitalization, a heart issue or something, that prevents them from getting a Medicare supplement, and they're, essentially stuck with a Medicare Advantage. Again, I use the word trapped and stuck, but there's some people that, you know, um, that Medicare Advantage is perfect for. Um, well, I wouldn't say perfect, but it's the best alternative in particular situations. Again, the if you got Medicare and Medicaid, definitely best alternative. VA, but again, I wish everybody could afford a Medicare supplement plan. I wish that category would go away. The reason I'm doing a Medicare Advantage is I can't afford the monthly premium, and I wish that category would go away. Yeah, and I wish the category of that with Obamacare, pre-existing conditions, no issue. With Medicare Part A, Part B, pre-existing conditions, no issue. Medicare Advantage, pre-existing conditions, no issue. Medicare supplements, health underwriting, how have you been, how's your health, and stuff like that. That's the last one of our health insurance matrix that has those qualifications, and I think it needs to change. And yeah, so there's that. Martina, what's up? I will be 65 December. So what do I do? All right, Martina, if you are currently working, you or your spouse, and have health insurance from work, and your employer has 20 or more employees, you don't have to do anything. You don't have to sign up for Part A or Part B or anything like that. If you're currently receiving Social Security benefits, the cash benefits, then Medicare will send you your Part A and Part B automatically. And at that time, if you have current insurance from work, you just refuse Part B, yours or your spouse's. But if you want to go ahead and sign up for Medicare Part A, Part B, and all that kind of good stuff, then you have to decide what you want to do. You choose a Medicare supplement or a Medicare Advantage. I've done several videos on the differences between the two. Again, you can fill out that form down there, or call my number, and leave a message, and we can have someone reach out to you and say, hey, Martina, looks like you're coming up the big decision in December. What's your zip code? And let's see what's available in your area. And they'll compare Medicare supplements versus the Medicare Advantage plans in your area. And then you make your decision. Suzanne, let's see. Can I have a separate insurance policy away from Medicare? I am considering an insurance company outside the system. I am 68. Yeah, if you have Medicare, then not sure what you have outside the system, because once you turn, you're 60. Once you turn 65, you can get an Affordable Care Act, Obamacare, but you lose the subsidies and the cost sharing and stuff like that. A lot of people have, retired federal employees have federal employee health benefits. They have health insurance from their state. There's retirement health insurance plans. So yeah, you can have all kinds of things outside of the Medicare Advantage, Medicare supplement system. Absolutely. Absolutely. Rose, Social Security office said I cannot apply for spousal benefits online. Can you explain or help? Usually, yeah, Social Security has been working on this for a long time, filing for surviving spouse benefits online. You can't do that online. But spouse benefits, you should be able to, unless there's something strange going on. Like if you're applying for independently entitled divorced spouse, those are because your ex-spouse hasn't filed for benefits, and that person is at least 62. Then yeah, you have to set up an appointment. But it really depends. Most of the time, people can file for spouse benefits, but in your particular situation, I guess you can't for whatever reason. All right. Are spousal benefits better as married or divorced? No issue at all. It's the same benefit amount. What that person's primary insurance amount, their amount at the full retirement age versus how much your benefit amount is, and when you're going to file for benefits. So, yep, no calculation difference whatsoever there. I don't qualify for Social Security disability, but they told me I qualify for Social Security with age. What is the difference? Good question. So for Social Security disability, there's two systems, two insured status requirements that you have to meet. There's that you're insured, that you actually paid into Social Security for 10 years, 40 quarters. So if you have, that means you're insured for disability and you're insured for retirement. But disability also has, you have to be currently insured. So that means 5 out of the last 10 years, any 5 years out of the last 10 years, you actually had to pay into FICA. So that's probably why they're saying you're not qualified for disability, because Social Security disability is you're filing disability because you're no longer able to work. But if you haven't worked pretty much the last 10 years, then it's like, well, you haven't worked in the last 10 years for the most part. So that's probably it. Yeah. You are not currently insured. But those, it's called DLA, the date last insured. So if you worked 5 years, but it was, many, several years ago, but you became disabled 2 years ago. So they used 2 years ago as the look back period for the 10 years. So in that case, within the last 12 years, minus, so the date last insured is, they'll have to run that. But if you know for certain that you haven't worked, 5 years in the time before you became disabled, then that's why it was denied. How do you know a broker is unbiased and not making money from insurance companies? Well, they all make money from insurance companies, all of them. So that's how they, support their families and pay their mortgage just like everybody else. But I know what you're asking. The steering, yeah. So what happens is with the team I use and every other broker in the country, agent broker in the country, when you sign up and when they, like, a broker says, here's 2 of the 3 of the best plans in your area, you wanted more dental and it's got more dental and this hospital's cheap and 0 premium and has your doctors and your prescriptions are cheap. Here's my recommendations 1 and 2. And you say, oh, okay, I'll do this one. And the broker doesn't care. They shouldn't. And then you sign up for that one, and then the insurance company pays them directly. What we see happening over the last few years is the big health insurance, Medicare Advantage health insurance companies have been paying a little bit extra for filling out little simple forms. All according to the government, everybody should pay exactly the same. And generally, every company pays the exact same. But these insurance companies have come up with little tricks that says, hey, if you fill out this little cute little form, we'll pay an extra $50 or $100 and stuff like that. So these brokers are kind of steering, sometimes agents and brokers are steering to your particular company. So Medicare, CMS, the Center for Medicare and Medicaid Services, recently came down in the last few months and said, you can't do that anymore. And that's it. You can't do that anymore. However, with the Supreme Court ruling, the Chevron deference that just came by a few weeks ago, that is pretty much out the window. The health insurance companies and big sales companies went to a judge in Texas, and the judge put a stay on that, an injunction, to where it looks like, yeah, they can kind of do that. So just find someone that you know and trust. And again, that's why I put together my team, because, yeah, so again, reach out to us and we can help you out. But yeah, just be, just look at the plan. They should recommend 1 or 2 plans, and then you look at those 1 or 2 plans, and if they're from different companies, but it really depends on your area too, so they might say, here's the best 2 plans, and it's from the same exact company because in your area, that particular company is the strongest. So that's the case. Yeah, there's so many variables. So that's why you just find someone that you trust. All right, let's see. Are your chances better getting approved for SSDI with an attorney? Not necessarily. I did a video. If you watch the videos I did on filing for disability, your chances are improved. But the initial stage and the reconsideration stage, you can do it yourself. You just answer the questions and on the internet, or when you set up an appointment, and it's the same questions the attorney would essentially ask you. But if you're denied at those two initial stages, then yeah, I would highly recommend getting an attorney. And I always recommend local attorneys. Don't, those national ads you see on TV, those big, clearinghouses. Get a local attorney that knows the local judges. And that way they're like, oh, you got Judge X. Oh yeah, I know Judge X. He or she, this is what he focuses on. And so I always get a local attorney. So they sell your info. These reps are my nightmares. Anyone asking for your personal info has something in mind that might not be your best interest. Yes, and that's another thing that Medicare, the government came down and said, you can't do that anymore, which the judge in Texas didn't throw out. So he didn't stop. He didn't put in an injunction. So basically, how it's been happening up until now is if you click a little thing on Facebook or you call or something like that, and they don't sell you at that time, Medicare, they don't enroll you in a Medicare Advantage or in a supplement or whatever. Then they say, wow, I just spent $35 for this lead for a Facebook ad or something, and I just lost $35 because they didn't want to buy what I had. So they sell your name, your information to someone else who sells it to somebody else and sells it to someone else and sells it to someone else. And that way you would get 400 calls. So Medicare came down and said, no, you can't do that anymore. And then the judge hasn't acted on that one yet. He hasn't thrown that one out. So this is good. So now if you say, hey, Ed and Ed's team, call me, then we'll call you. And if you're in the best plan, then that's it. We're done. We'll see you next year. But other companies are supposed to do the exact same thing. And if they don't, then, I would ask people, hey, how'd you get my information? Did I press your Facebook button? Did I tell you specifically to call me? Oh, no, I got your name from a friend of a friend of a friend of a friend. It's like, well, yeah, then I would call somebody. We need to stop these calls. My husband took Social Security at 62. Really not very much, $950 a month. I am on SSDI, monthly benefit $17.99. Question, can my husband collect anything off of my record? No, because your benefit amount is not twice his full benefit amount. Yeah, because he took it at 62, so his full benefit amount is probably what, 12 or 1300, and yours is 1800. So unfortunately, no, at this time. Yeah. That changes with survivor benefits, on spouse benefits, living spouse benefits, divorce spouse benefits, all that. It's up to 50%. One has to be over twice the other one. But when the person passes away, it gets up to 100%. And so please share this video and like and all that kind of stuff, because there's so many people out there that called Social Security a year ago, 5 years ago, 10 years ago, and said, hey, can I get any money off my divorced spouse? And they say, no, you can't, simply because it was 50%. And then since then, that person has passed away, but the surviving divorced spouse is just sitting there saying, well, yeah, no, I called Social Security a few years ago and they said I can't get benefits on that record. No, just simply because of the calculation. Now you can. So there's a lot of people out there, and we've found a lot of people. Y'all have found a lot of people by pressing like and all that kind of good stuff that have gotten money. I didn't know I could get. I was told years ago I wasn't entitled. No, the only reason you're not entitled is because there's no more money. So to be entitled for Social Security is you have to be, 62, at least 60 years old for survivor benefits, and you're not working, or they'll hold back benefits. You had to be married to that person for 10 years, or married to them when they passed away. If it was within 9 months, if you were married to them when they passed. But there also has to be money there available. If there's no money, then you're not entitled. Just doesn't mean you're not entitled forever. You're just not entitled at that particular time. So share this information. Does this year's IRMA's joint income limit of $206,000 pertain to people who are 65 this year? Yes. I am 63 and don't know what limit will be taken when I'm 65. It's confusing. Yes, unfortunately, it's confusing. So you're talking about the IRMA, the income related monthly adjustment amount. It's the extra Part B premium that high wage earners pay. And yes, it is based on your earnings from 2 years ago. However, so if you're 63 this year and you're making over 206,000 as a married couple, 103 for a single. And then 2 years from now, once you sign up for Medicare, if you do sign up for Medicare, if you have health insurance from work, you don't have to. But if you do sign up for Medicare, then you're going to get that extra Part B premium. You're not going to pay $174.70 like everybody else. You're going to pay quite a bit more. However, between now and then, if you stop working and stop receiving that, then you have what's called a life-changing event. And you just fill out a form, SSA 44, and say, yeah, I made $1 billion 2 years ago, but I have since stopped working. And so you won't get penalized. So just come back at that time. Hopefully I'm still around and I haven't completely gone bald. But Nixon is the one who had ESRD go under Medicare in 70. Yeah, the ESRD, end-stage renal disease. That was yes, a very good one. And that's also SSI is celebrating its 50th anniversary. It was started in the early 1970s. This SSI is the welfare-based program, supplemental security income. I can apply my unused OTC toward future light bills. Also, I paid my cell phone bill with it. Hope this helps some. Yes, those. And this is another thing Medicare came up with, which, again, based on that Supreme Court ruling, I'm afraid a lot of this good stuff is, obviously the government bureaucracies, they overstep their boundaries sometimes, but sometimes they do good stuff, right? And this is another good thing they did. Hopefully this is not thrown out by that Chevron decision, Supreme Court decision. Medicare said, okay, companies, Medicare Advantage companies, you entice people to sign up for your plans by showing all these cool, shiny objects, over the counter and extra dental and gym membership and stuff like that. But then for some reason, they're not using those benefits that we are paying you for out of this person's money, but this person is not using it. Why? Are you making it difficult? Are you not letting these people know? Whatever the case may be. So starting next year, you will get a letter in the middle of the year that says, hey, Teresa, you have, we gave you an over-the-counter card and it has $100 a month, and we noticed you haven't used it all. You only used $20 of it. And we just want to let you know. So the government came down and says you have to do that nowadays. You have to remind people mid-year that, hey, remember, you have dental, you're paying for it. We're getting, the Medicare insurance company is getting the money for that extra benefit from the government, from the money you paid into the government. So we're just reminding you to use it. And that's another reason why these health insurance companies are kind of freaking out for 2025 and, cutting back on benefits, because people are going to start using their benefits and they're like, oh, that's, CEO can't get that big yacht he wanted. So, oops, did I say that out loud? All right. Okay, looks like some people are answering other people's questions. Margaret, what's up, Margaret? Was married 10 years. I'm turning 65 next year. Can I collect on excess, then switch back to mine at 66 or 70? No, unless your ex is deceased. You can collect survivor benefits and just collect survivor benefits and don't touch your own and let your own increase. But if that person is still out there alive and kicking, no, you have to file for benefits on yours first. And then if there's extra money there, then you file for those other benefits. Freedom World. Thanks for the information. You print. Hey, you're welcome. I love your thumbnail. Yeah, I kind of like that one too. It just came to me. It's like, yeah, it's a trap. Yeah. Yes, Margaret. Yeah, Penelope is always spot on there. You would have to take your own Social Security first, unless the other person is deceased. Hi, is there a plan for vision and dental? Yes. Obviously, if you get Medicare supplement, like an NRG, it doesn't have vision or dental or hearing there. And then if you get a Medicare supplement, you also need to get a Medicare Part D plan. And some people get a dental or a vision plan. And with Medicare Advantage, some of those are in there. Some of them are great. Some of them are not so great. I've got a company that I recommend. If you look I think I have a link on it somewhere, but it's the one I recommend. Let me see here. I'll just pop this in here. And that's again, if I was dictator for a day, that's one of the first things I would add into original Medicare is dental, vision, and hearing, because how healthy are you in retirement if you don't have that kind of stuff? Yeah. All right. Could you please explain Medigap? Would I be able to use it on SSDI? Um, that's another unfortunate thing. So Medigap, Medicare supplement, same exact thing, the plan N and G. In most states, because insurance is regulated by the state, and in most states, they don't make the insurance companies provide Medicare supplement plans to people under 65, because the Medicare supplement insurance companies went to your state politicians and said, don't make us give it to people under 65, because people under 65 that had Medicare get Medicare because they're disabled. Those people cost us a lot of money. Don't make us give, Medicare supplements to those people. So your state politicians have said, okay, as long as you hook me up in my next election. Yeah. Did I say that out loud? So the only thing you can do is get a Medicare Advantage in most states. However, once you turn 65, you're in a free period where you can switch from Medicare Advantage to a Medicare supplement plan. And because you're in your 65, guaranteed you got it. They can't deny you or ask you about your disability. They can't charge you extra. Some states, they went kind of halfway. They tried to appeal and says, okay, yeah, we will make sure insurance companies are able to provide you these Medicare supplement plans because we're cool, but we're not going to regulate how much extra they can charge. So in some states, you just can't get Medicare supplements under 65. In some states, you can get them, but they cost 3 or 4 or 5, 6 times more than everybody else at 65. So yeah. Thanks. They did not explain how much I would be getting for SSI aged. For SSI aged, so for SSI, the supplemental security income, you get SSI based on disability under 65. If you're 65, you get it SSI aged. And that's the max you can get is $943. So, and then there's all kinds of, if you have any other Social Security benefits coming in or any other income, they kind of use a calculation to subtract that. Edward, first of all, I have never had a problem with my Medicare Advantage plan not covering medical bills. I don't have a premium or deductible to pay. The drug plan works well for me as well. Yes, a lot of people, there's a survey recently, again, over 50% of people with Medicare Advantage, or over 50% of people on Medicare have Medicare Advantage, and a lot of those people are happy with them until they're not happy with them, until they get sick or fall or something like that. The insurance company gives them a hard time about this, that, or the other and stuff. And again, are we in that golden period where the health insurance companies are bringing you in and making you happy and everybody's happy? And then, yeah, and then, so, but hopefully everybody, Edward and everybody else continues, how it's going for Edward. I certainly hope so. I really, really, really hope so. I'm trying to be an optimist. Being pretty healthy and on a dual complete plan with perks, it will be a good time to just go back to Medicare with Medicaid if I'm not going to get the extra money for groceries, supplements. Yeah, for if you have a dual, the dual eligible complete plan, because you're on Medicare and Medicaid, I would stick with that, because you're going to continue to get the extra benefits and, dental and vision and, the OTC and the electric, whatever is available in your area. And with yours, you're allowed to, because you have Medicare and Medicaid, you're allowed to switch your plans several times a year. You don't have to wait till October. If you have the extra help with prescription drugs, you can switch your plan several times a year. If you move, you can switch your plan. So there's different special enrollment periods. But you, Carol, I would probably stay. I would consider staying, unless, again, you start getting home health care, and then you reach out to home health care companies, and because the Medicare Advantage dual eligible plans, they say, oh yeah, we have home health care. Yeah, we have it. Okay, yeah, they offer it, but is it actually there in reality? Because you call around all the home health companies in your city, and they're 10 or 20, and you call them up and say, I have a Medicare Advantage company. Click. Yeah, we're contracted with them. We did the contracted with them, but yeah, no, we'd rather deal with Medicaid because we get paid more, we get paid quicker, and we don't want to have to jump through all the hoops with Medicare Advantage. So yeah, but if so, that's I would be just and until that happens, I would probably I would consider sticking around with it. Get that extra money. What Advantage plan do you have, Edward? Yeah. That's one thing I would avoid is in again, all the plans are completely different. There's thousands of different Medicare Advantage plans throughout the country. They're all different. Unlike Plan N and G, which is N and G is pretty much the same, throughout the country. Massachusetts does something strange, but well, they just don't have N and G. They have a different thing. But Plan N and Plan G is Plan N and Plan G done. End of story. Super, super simple. Medicare Advantage, there's hundreds of them, different ones, and they change every single year. Lori, you live on one side of the street, and Edward lives on the other side of the street, and Edward's Medicare Advantage plan might not be available on your side of the street. That's how it's broken down by area, zip code, and sometimes within the zip code. And Edward might have different doctors than you do, or different prescriptions, or need different things. So I would never pick a Medicare Advantage plan because your neighbor has that one, unless y'all are twins and have all the same doctors and all the medical. Yeah. So let's see here. I signed up my boyfriend online and he didn't have a lawyer. He got approved in 3 months on SSDI. He's now on retirement age 65. Yes, awesome. Got approved in 3. Well, that's not awesome. That means he had a terrible disability and it was pretty much a slam dunk. So that's unfortunate. But it's fortunate that Social Security did the right thing and got him his money. But yes, you're right. Once you hit your full retirement age, then the benefits switch to regular retirement. The check stays the same and all that kind of good stuff. And remember, now that if he is 65, then you can switch from Medicare Advantage to a Medicare supplement. Again, if it's within your budget. If it's not within your budget, then hey, it is what it is. Thank you, Ed, for what you do. You're welcome. Sweet bug, once you're in the system, they will keep bothering you. I get phone calls every day in mail. It was not for flicking on anything online. That's so wrong. Yeah. There's a way to do that. All of these agents, brokers are contracted with companies. And you know the names of the companies. I try to avoid saying the names of the companies. Those companies are, they don't want to get in trouble for Medicare. So if you get someone that, is harassing you and calling you and you're like, how did you get my number? And they're, kind of be vague and, not answer the question, then you can, if you want, say, okay, let's talk. What's your name and what's your phone number and stuff like that. And then, and they recommend plan, Medicare Advantage company X, Y, and Z. Call Medicare Advantage company X, Y, and Z and say, hey, this person just called me and I never told them to call me. So they must have bought my information from someplace. They shouldn't be cold calling me like that. Yeah, Medicare, that's Medicare insurance agents and brokers are regulated like nobody's business. That's why when you go into, some pharmacy or place, they've got that Medicare table there. And then it says, they're just someone sitting there staring off into space. And it says, ask me about Medicare. And all you salespeople out there, these Medicare people, these are terrible salespeople. They should start talking to people. No, they can't. They can't talk to people. They can't open their mouth until you ask them about Medicare. So yeah, until you say, what about Medicare? Then they can start talking to you. But if you say, hey, what's up, man? How's it going? Good. And then, they can't say they can't say the words Medicare until you ask. So that's how regulated the whole thing is. I signed up for SSDI a few years ago and got accepted on the first try. I put your videos on playlist on my channel. I do receive benefits from ex-spouse. We were married 49 years. Yes, see, I did that video a couple of days ago about, people getting, kind of two checks. So Robert gets two checks. It's all in one direct deposit, but he's getting disability benefits and Medicare based on those disability benefits. And on top of that, he gets benefits from surviving spouse or divorced spouse or spouse, whatever the case may be. So one doesn't nullify the other. You can continue to receive essentially two checks because those come from different. The one check comes from the disability trust fund and another one comes from the retirement trust fund. So it is possible, but unfortunately, hundreds of millions of dollars probably out there that people are just sitting there, you know, not getting their benefits because they're saying, "Oh, I'm disability. If I file for this, my disability will stop." No, it will not. Oh, we're way over here. Let me jump down to someone that I don't recognize that might be new here. Viali, do you have to pay out of pocket for both Advantage and supplement plans? Supplement plans, yes, they all have a premium. The Advantage plans, most of those are zero premium. And that's another thing. Medicare insurance agents and brokers can't say Medicare Advantage are free. If they say that, yeah, they can lose their license because it's not free. Medicare Advantage is zero premium, but you have to pay for maybe your doctors or specialists or CT scans or MRIs or hospitals and the prescriptions and stuff like that. So all of the costs, there's zero premium, but when you actually use it, that's when it costs. So it's not free. It's zero premium. So yeah, that's another reason. Okay, let's see here. Let me get two more people I don't think I've seen before. Karen, what's up, Karen? Will Social Security go on my deceased military husband PIA and DRC to establish my widow fraud benefits? All right. So yeah, the delayed retirement credits, the person has to have delayed receiving Social Security benefits until after their full retirement age. So if your deceased husband waited to start collecting benefits after their full retirement age, you could get those delayed retirement credits. If that person just never filed for benefits, then yeah, it'd probably just be the well, if they were waiting after their full retirement age and they passed away at like 69 or something like that, then Social Security assumes that they were waiting, and basically the DRCs are calculated, the delayed retirement credits are calculated based on the month that person passed away if they never filed for those benefits. Florence, this will be the last one. I get $940 on SSI disabled. In 2014, had the Advantage Plus, and some things I have copay. Having a breast tumor with 15 cancer cells to be removed this week. Afraid to know that bill. Again, they have the maximum out of pocket. So yeah, so there's that. And I would definitely, check to make sure you're doing the right thing there. Yeah, sorry to hear about that. All right. So yeah, we're way over. Y'all have a great night and